Hi, this is Teresa, one of the interpreters. Just to say that the other interpreter's struggling to get in, so we're just trying to sort that out at the moment. Hi, is it possible to, I'm not quite sure, is it Helen chairing the meeting? Helen available?
Yeah, Helen normally chairs, and I can't see her at the moment, but she should be here in a moment.
Hi,
Well,
Noel.
she doesn't chair it; she just convenes it.
Yeah,
Okay,
so I'm in the background as part of the organising of it. The meeting will be chaired by Sir David Nicholson, as per the agenda we sent you.
Yeah, it's okay. It's only about who's managing in the background, because obviously, as interpreters, we swap every 15 minutes.
Yes, that's fine. If you just pop your cameras on and off, we will continue with the spotlighting to keep you on the screen. Thank you so much.
Thank you very much. No worries. Thank you.
Hello, good afternoon, everybody. My name's David Nicholson. I'm the chair of the Dudley Foundation Hospital Group Hospital. It's an absolute privilege for me to chair your annual members meeting. Can I just ask something to begin with, though? Can I ask people who are not speaking or not asking a question to turn their cameras off? The reason for that is not because I don't want to see your faces. Obviously we all want to see your faces. It's because in order to make sure that we have proper sight of the British Sign Language interpreter when we do the recordings and send them out to other people. So if you could turn your cameras off, that would be fantastic. We'll be able to do that better. Thank you for your cooperation. So as I said, my name's David Nicholson. I'm the chair of the organisation. I was delighted to take up post in the organisation at the beginning of September. I'm also the chair of Sandwell and West Birmingham NHS Trusts, and looking forward to seeing the benefits of the dual role to bring the two trusts who already work together, working even closer together. Collaboration across the Black Country is going well. We have a provider collaborative, which also includes Wolverhampton and Walsall, and we see ever closer work between the four organisations to improve services for all our patients in the Black Country. I'd like to take the opportunity to thank my predecessor and recognise the great work that she did, Dame Eve Buckland, her dedication and professionalism, taking the Dudley Group from some difficulties into a much better place, I think. In fact, she did such a good job that there's less for me to do in those circumstances. But great progress has been made over the period, and Eve did a fantastic job. I'd also like to thank the board of directors and our great council of governors. They invest huge amounts of their own personal time into the governance of the organisation, giving the right elements of both challenge when we get things wrong and support when we get things right. So thank you to those people. I'd also like to thank the wonderful staff of our organisation. One of the things that I would say, and I've visited many hospitals over my time in the NHS, some 40 years, and I have never met a group more welcoming, enthusiastic and proud of their organisation. We are not without our problems, heavens above. We can see all of that. We can see the issues that we have to deal with, but nevertheless, thank you to the staff for fantastic work that they do on a day-to-day basis for our patients. And can I also thank our patients and our community for the fantastic support that they give us, giving us feedback when we get things right, but also when we get things wrong. Really important for us as an organisation to learn as we go forward. And can I thank also our wonderful partners, the Black Country Mental Health Trust, General Practice, local government. We could not deliver great services and outcomes for our patients without those partnerships working very closely together. And I'm hoping over the next period we can really increase the amount of partnership working that we're doing across Dudley to improve the services and outcomes for our patients. Dudley is a remarkable healthcare system, a remarkable hospital and community services, and we are recognised outside for the work that we do, both as an organisation, one of the top performing hospitals in the region, but also by the recognition that our staff in particular get. And I'd just like to identify a couple of people who got particular recognition over the last period. Alex Griffiths, who was given a British Empire Medal in the Queen's Birthday Honours List 2022, a remarkable young man who's been a carer since 5 for his mother who had multiple sclerosis, who looked after his grandparents, who did an enormous amount of work in the community supporting people through COVID, and then joined us in an apprenticeship scheme as a clinical support worker. Alex is in a day-to-day role, involves him in supporting people at end of life and supporting seriously ill patients. A remarkable individual, and I would like to add our recognition to that. Secondly, Claire Nash, who, like me, is working between Dudley and Sandwell and West Birmingham. She's a clinical nurse who works around procurement, making sure that, first of all, the things that we buy, the equipment, the materials that we buy are absolutely fit for purpose and will provide real benefits for patients. But also, I know Claire is particularly connected to sustainability in the environment to make sure that this hospital makes its contribution to net zero over the next 10 to 15 years. And she's been recognised through the supply awards and through the NHS Midlands Excellence in Supply. We've also had recognition for a number of our staff as part of Black History Month and the celebrations, and 3 of our members of staff were nominated for making particular contribution through that. Sarah Gregory, who's played an enormously important work assisting our internationally recruited nurses to settle and integrate in the teams. A remarkable group of people who've come across, halfway across the world to help us at this particular moment deal with the staffing problems that we have. They're making a great contribution to our patients, and Sarah's played a really important role in connecting them together. Janice Nelson, who's been implementing an equality, diversity and inclusion procurement strategy, particularly working with those suppliers, small businesses, often from ethnic minorities, who sometimes have difficulty connecting with large organisations like us to provide goods and services. She's worked really hard to make that a reality. And Harriet Wanren, who's made an outstanding contribution award for her leadership, and in particular around the vaccination service. So really impressive ways in which our individual staff have been recognised for the contributions that they've made. And it's no accident that our Director of Communications can't be with us today, because she's in London. We've been nominated, the Trust have been nominated for an Excellence in Communication Award for the work that they did around the staff survey and getting people to contribute to feedback that we desperately need in order to improve our services. So thanks for all of that. We've got a packed agenda tonight that you will have seen. There will be opportunity for people to ask questions and make contributions as we go along. I'd just like, for those of you, and I sadly weren't here last year, there are the minutes of the last meeting. Can anyone who was here, or people who were here, confirm in some way that they are a reasonable reflection of the conversation that was had? Yes, I've got that. Okay, thank you very much. I can confirm then that they are a reasonable record of the work that we did. Now, can I pass over to the Chief Executive of the Dudley Group, a fantastic. We're very lucky to have Diane as a chief executive, a remarkably experienced individual who's done great things in this trust, but will do even greater things going forward. Diane.
You're on mute, Diane.
Thank you. Well,
That's the first time I've done that today. I was just saying I'm delighted to be here this evening at our annual members meeting, and thanking the chair for the kind words. It's a real opportunity for me to share with people who are attending this evening the many success stories from the past year, and take a look at what we've got planned for the coming year. So more than 2 years after the first COVID cases in the UK, the NHS is still navigating its way through a huge demand for its planned services and seeing a massive increase in demand for its emergency services. And this year, sadly, we've also seen the world focus its attention on Ukraine in its war with Russia, which has had a huge impact on many people, and here in Dudley as well. The NHS has changed dramatically also this year with the introduction of the integrated care boards known as ICSs or ICB, and our ICB covers the whole of the Black Country. And we've also seen the removal of the clinical commissioning groups. So the trusts that are part of the Black Country ICB are the Dudley Group, Walsall Healthcare, Royal Wolverhampton and Sandwell Hospital. So it fills me with great pride to take some time to think about the amazing work that our staff, volunteers and partners do each and every day for the communities of Dudley and beyond. And I would like to genuinely say a massive thank you to every person involved with providing all of our services across the borough. And we have just heard from Sir David some of the award winners we have had this year, and that makes me so proud. And as we move forward into the winter months, we also have thoughts for those residents who are struggling with the rising cost of living, and recognise that some of our staff may have some of those real concerns too outside of work. We are providing as much support as possible to individuals who need our help, and our health and wellbeing offer is stronger than it's ever been, with many services established during COVID, and we are continuing to support our people, and we continue to make additions to that offer as we begin to adapt to the current cost of living issues we face. Research is a really important part of the Trust day-to-day business, and our medical director Julian Hobbs and clinical colleagues, and particularly Gail Parsons, really champion research within our organisation. And following the success of our COVID research studies, our Research and Innovation Department continue to expand the offer to our patients for increased opportunities to take part in research. Alongside COVID studies, we have reopened studies that were paused due to COVID, and we've now been able to open new studies to improve treatment options for our patients. And a really good example is we are the top recruiter in the UK for a new treatment for patients with heart failure, which is the Victor study. We recruited the first UK patient into the Repairs MDS, which is a haematology treatment study. And we were the first to recruit 2 patients in the UK into the Mosaic study. And that's for patients with acute kidney injury in critical care. And it is exceptionally rewarding to see that our research activity translate into real advancements and improvements in patient care locally, nationally and internationally. And a really good example of that is breast cancer patients in the UK can now receive fewer radiotherapy sessions following surgery after the Fast Forward trial. That confirmed that a 1-week course was as safe and effective as a standard 3-week course. The new treatment schedule is now being adopted internationally. And that really just tells you what being part of research can do for our patients. Russell Hall Hospital is the home to the Black Country Vascular Hub, and we are absolutely delighted that once again it was rated #1 in the country for ensuring patients with abdominal aortic aneurysms get potential life-saving surgery in a timely manner. So I'd like to give a massive thank you to the incredible hard work of the members of the Black Country Vascular Network. We have been ranked as the best performing out of 38 other triple aneurysm screening programmes for meeting standard pathway time to surgery following initial identification. Other groundbreaking news, we've got a new procedure now being used in Dudley, and you can see our team there on the slide. And this is a procedure for men with prostate problems, and it prevents them from having more invasive surgery, improving their quality of life and saving them days of staying in hospital. The revolutionary steam treatment is being used here at this hospital for non-cancerous prostate gland enlargement, which is common in men over 50. So symptoms like needing to pass urine more frequently, trouble starting to urinate and loss of bladder control affect more than 1/3 of men over that age. And so the urology team at the Dudley Group, led by consultant Mr. David Matthews, has begun treating patients with male benign prostatic hyperplasia as day cases. Previously, men having moderate to severe symptoms which did not respond to medication had to have a much bigger operation, meaning often several days stay in hospital to recover. We're also absolutely pleased and delighted to offer the new closed-loop insulin pump system, an artificial pancreas which is eligible to patients. This is the diagram on the slide of a typical setup. The sensor monitors glucose levels and automatically adjusts the rate of insulin infusion through a pump. This has been shown to improve diabetes control and also frees the patient from painful finger prick tests and having to do lots of complex calculations, and it allows them to get on with their lives. Patients only have to boost the pump when they eat carbohydrates, and we are now able to offer devices to all of our eligible patients, including adults with type 1 diabetes, pregnant women, and even children. The kindness and empathy of our healthcare staff has also been praised in report by the national body into the audiology service located at Brierley Hill Health and Social Care Centre. The service has retained its certification by the United Kingdom Accreditation Services UCAS following an on-site assessment and submission of evidence. The audiology service provides adult and paediatric audiological assessments and rehabilitation, although the accreditation is only for adult services. And again, on the slide, you can see our team there. Respect's also on this slide, and this year we saw the launch of the Respect, a national process led by the Resuscitation Council UK. It stands for Recommended Summary Plan for Emergency Care and Treatment, and it is a process where the patient and their healthcare professional talk together to work out a personalised plan for the potential future emergency treatment. This plan is used in emergency situations where the patient is unable to express their wishes, and it will ensure that patients receive the best possible treatment for their individual situation. Looking forward, so future collaboration. Throughout the past 18 months, we have been building on the best practice that came from the pandemic and collaborating across all partners within the Black Country. As Sir David has mentioned earlier, we are an integral part of the integrated care system in the Black Country, with key leadership roles that enable us to put collaboration at the heart of the Dudley Group. As I've just given a snapshot of the great work happening here in Dudley, it is quite right and proper that we should be proud of our staff and volunteers in embracing new ways of delivering the best possible healthcare. Working with our partners across the Black Country, we have focused on reducing the longest wait for our patients across the region, supporting one another where we have capacity. And we are really pleased to have no patients waiting over 104 weeks. And we are working very hard to eliminate waits of 78 weeks for our elective patients and 52 weeks. And we have done this through working together as 4 partners in acute hospitals across the Black Country. We have also focused on improving access and reducing variation across all the 4 Black Country places for patients we are treating with cancer. Through working together on key pathways, we have managed to improve our 2-week wait access time for patients with suspected cancer and also the treatment time within 62 days. We've also been extremely successful in securing additional funding to support community diagnostics. We've got facilities at Cannock Hospital, we've got a phlebotomy hood at Mary Hill, and we've also got community diagnostics at Corbett and Guest Hospital, enabling faster diagnostic tests to be undertaken. We've also secured funding for additional theatres at both Cannock Hospital and also Walsall Hospital. We've supported teledermatology, and we're currently rolling that out into the community. And we've secured funding for robotics, and we're bringing robots to undertake surgical procedures here at Dudley and at Sandwell. And we are soon to have a robot that will operate out of Cannock Hospital for orthopaedic surgery. The strength of our collaboration is absolutely paramount, but what I would like to say that this collaboration is clinically driven and clinically led. And that is so important to us, that we get the clinical pathways right, led by our clinicians. And I've just mentioned very briefly, and on this slide you can see that we've recently brought healthcare into the high street with a new blood test centre in Merry Hill, and we were really proud to open that within the shopping centre. It improves access for our patients and it increases our phlebotomy capacity. And car parking is so easy for our patients attending Merry Hill, and we're really delighted about that. We'll accept walk-in patients, and you can also book online. And this is part of our plans to improve access to diagnostics across the Black Country, utilising some of the £8 million invested into these services. The local diagnostic recovery plan is providing money to invest in new equipment such as MRI and CT scanners, and to fund extra staff sessions to deliver around 46,000 new tests within the community setting. On the next slide, you'll see our fantastic Rainbow unit. So our first patients moved into the new acute medical unit called the Rainbow unit on the suggestion of our staff, and that happened on Wednesday, the 10th of November 2021. As well as providing extra bed space, the new unit sees patients receive early single assessment by medical teams, avoiding duplication of the work in our emergency department. And it is a fantastic facility, and you can see on that slide how proud our staff are of that facility, and our staff came up with the name, calling it the Rainbow unit. So I would now like to introduce our featured service. So we've got ophthalmology, who will be sharing their latest development in being the first trust in the country to offer a new form of eye injection that can treat ailments such as macular degeneration and diabetic retinopathy. Unfortunately, Mr. Shadad Shafqat, who is leading the way in this area, cannot be here this evening, but we have got Mr. Baba Ilahi, and he's here to introduce it. So over to you, Baba.
Thank you very much. It's an honor to present here to the annual members meeting. I'm Baba Ilahi. I am Chief of Surgery, Women and Children. I'm also an ophthalmologist. I specialize in glaucoma. So Mr. Shafqat couldn't be here, but this is about, I'm going to represent him and represent the department and share with all of you an interesting and innovation that we have launched in Dudley. There's a new treatment, which is an eye injection to treat blindness, which could be caused as a result of macular degeneration or diabetic eye changes. And it has a vast burden on our resources because of the number of injections that are required. So Dudley Eye Department had the privilege of having the first injection, first in the UK, first in NHS. So the patient which received this injection was a Dudley patient in July 2022. And I would then pass on to Mr. Shafqat, has very kindly sent a video presentation, and we will listen to his presentation and we'll take it from there. Thank you.
Hello, my name is Mr. Shahzad Shafqat. I'm a consultant ophthalmologist at Russellstown Hospital in Dudley and retina lead. And thank you for the opportunity to speak to you all about the launch of this novel drug, which is a groundbreaking drug to be used as an injection in the eye. So just to give you a little context of what we're talking about, we're talking about two conditions which are the commonest cause of blindness in the Western world: wet age-related macular degeneration, which is the commonest cause of blindness above the age of 55, and diabetic retinopathy, which is the commonest cause under the age of 55 in the working age group. Macular degeneration affects about 600,000 people in the UK. These are Royal College figures. 90% of people with type 1 diabetic retinopathy will have some degree of diabetic eye disease within 10 years of diagnosis. 70 to 80% of people with type 2 diabetes will have some degree of retinopathy after 10 years. And 30 to 35% of all diabetic people will at some point in their age develop diabetic swelling at the back of the retina, which will affect their vision and require treatment. So this puts a huge burden on ophthalmology departments across the world, not just in our country. Ophthalmology outpatient visits are second only to orthopedics in the entire country. So it gives you a perspective of what a large number of patients we are dealing with on a regular basis. So at Dudley Group, we perform around 6,500 injections, intravitreal injections a year. So we are constantly looking at treatments and regimens which will reduce the footfall in the hospital. So it's less of a burden on the population, less of the burden on the resources of National Health Service. So the current status of treatments is that we initially started off with ranibizumab or Lucentis, which was a monthly injection. Obviously, the patients had to come quite frequently. We moved then on to aflibercept or Eylea, which was a 2-monthly injection. In February 2021, we were the first to launch brolucizumab injections, which is a 3-monthly injection, which brings me nicely to this new drug, faricimab or Vabysmo, which is a 4-monthly injection, which will definitely reduce our treatment frequency and burden on the society. So just to show you a little bit about what we are talking about, you can see on your screen a picture of normal retina. It shows on the left of the picture, you will see the picture of the retina. On the right, you will see an OCT retinal scan. Now, people who visit the eye clinic know that this is an integral part of the eye examination. The second picture that you will see is that of wet age-related macular degeneration, and you will see on the left a hemorrhage affecting the center of the retina, and the scan will show a bump caused by accumulation of fluid under the surface of the retina. The third picture that you will see is that of diabetic retinopathy. On the left, you can see a retina which is affected by multiple hemorrhages and white spots on the retina, the areas of leakage that we call exudates and hard exudate and cotton wool spots. On the right, you will see the OCT scan of the same patient showing a lot of accumulation of fluid and thickening of the retina and the formation of a blister. So this is what we're trying to deal with. So I'm going to show you one slide of this new wonder drug. It's the world's first biphasic anti-VEGF injection. It is 2 drugs essentially in one molecule in one injection. So if you look at the slide, it shows that it has a anti-angiopoietin 2 fragment and anti-VEGF-A fragment combined together in this antibody. And the slide summarizes what the drug achieves. It is anti-inflammatory, it reduces hemorrhages and leakage from blood vessels, and it is the most potent drug that we have in our armamentarium at the moment. I'm very proud of the team that I lead here, which comprises medics, nurses, injectors, clinic coordinators, and our pharmacy team. I was the proud recipient of a Clinical Lead of the Year award from Macular Society 2020 that was awarded for our seamless service during the pandemic years. Thank you very much.
Thank you very much.
Seamless. Thank you very much for that, Barbara. I think you'll agree that not only is this a really important kind of step forward in terms of the type of drug and the effectiveness of it, it's also a step forward in relation to the experience of the patient. I can't imagine what it's like having an injection in your eye once a month, but having it in your eye every 4 months, it seems to me a huge step forward. And the best thing about this is that the Dudley patients are the first patients in the UK to receive that service. So fantastic! Thank you very much, Bob.
Thank you very much.
for that. Let's move on now to our Director of Finance, Kevin Stringer. Kevin, together with Alan Duffel, our HR Director, Chief People Officer, have been lent to us by Royal Wolverhampton Hospital. It shows the burgeoning and important relationships between the various hospitals in the Black Country. And we thank Royal Wolverhampton for allowing us to use Kevin in this way. But Kevin, over to you.
You're on mute, Kevin.
Thank you, Helen. Good evening, everyone. Apologies for that. Thank you, Sir David. It's been a pleasure to be lent by Royal Wolverhampton to Dudley Group. It's been an absolute pleasure working with everybody. So a few brief slides on financial performance for Dudley Group for 21-22, and then I have a few slides on the charitable funds also. Just to say, all of the accounts and the annual report is available to people on the website. And if anybody needs a copy, then please contact us and I'm sure we can provide them. So the context very quickly for the group: increased turnover from 451 million the previous year to 519, an increase in turnover of 15%. And as you'll see from this slide, an achievement of 1.8 million surplus. When you take away the technical adjustments and impairments as shown in the slide to get to what we call the break-even duty to compare to other trusts, the trust delivered a 3.8 million surplus, which is an incredible achievement given the context in which it was working. Capital spend was 19.3 million, and I'll go into a bit more detail on a slide coming up. And the cash balance as at the 31st of March of 2022 was 24.6 million. Next slide, please. What we've tried to do in this pie chart very quickly is show you the breakdown of income for the trust against its 519 million turnover. And what you'll see is the vast majority of the money comes from the Black Country and West Birmingham CCG, who account for around about 74% of the total income of the trust. And just to say, throughout the year, while dealing with COVID and recovery, the vast majority of the contracts which we earn money for our patients that we see were under block contracts and also some top-up funding. And you'll see a few other CCGs within the Black Country and education and training monies totaling 14.4 million. Next slide, please. On the expenditure pie chart here, what you'll see very clearly against the 502 million cost base that we have, the vast majority of the money that we spend is in salaries and wages, and that's for all of our nurses, doctors, allied health professionals, admin and ancillary staff, and they account for around about 66% of the total cost base of the organisation. You'll then see other big numbers for drugs, supplies and services for frontline care, and again they total about 20% of the remaining fee. The only other one probably to bring to highlight for the audience is Clinical Negligence Scheme for Trust, CNST, which is the insurance that we have to have in place for providing clinical services, accounting for around about 6 or 7% of the total cost. Next slide, please. Capital expenditure, as I've said before, 19.3 million spent in year for 21-22. And as the chief executive has already said, one of the big elements that we spent was on the Rainbow unit and that wonderful pitch of staff celebrating the opening of the unit. And the other big areas to point out for the organisation, IT investment and infrastructure, which is so key to make sure electronic patient records and our staff have appropriate digital areas that they can use upon their wards in their day-to-day care of patients, as well as making sure that the medical equipment is available and as up to date as we can in the replacement programme and the estate's maintenance. Those are the main areas of spend on capital. Next slide, please. The financial output for this year for 22-23 is challenging, and I think as we move out of COVID and we get into recovery, there are a number of challenges for the group that we're starting to work through. So setting a plan for 22-23 was indeed challenging, and whilst we were encouraged to deliver a break-even position in the plan, that has come with a high degree of risk, as we've found out as we've gone throughout the year. The third bullet point talks about elective recovery funds. So there is an opportunity for the trust to earn monies based on the activity levels it does from an elective point of view. But again, that's proved to be extraordinarily challenging. And whilst Dudley Group have significantly increased the amount of activity they've done year on year, we haven't yet been able to deliver additional ERF, as it's called, for this year. In setting the plan, a cost saving target and efficiency requirements was built in of £29.7 million, so that we can be as efficient as we possibly can in all the money that we spend on behalf of taxpayers. And that's proved to be particularly difficult, although we are going to make a significant contribution towards that by year end. One of the aims of the organisation has been to reduce agency spend, and I'm sure you'll hear later of the great work done in terms of recruitment for our nursing and our doctors in particular, and the overseas recruitment has gone extraordinarily well for the organisation. And again, you've heard several times from previous speakers, greater collaboration within the system with other providers has been an absolute opportunity to improve care for our staff and our patients. So I'd just like to say thank you to the board, to the directors, the budget managers and the staff for delivering the financial duties of the group. Next slide, please. So these groups of slides talk about the charitable annual reports, in particular the Dudley Group NHS charity. And the charity is set up to support the trust vision to provide safe, caring and effective services. But what they do is enhance and further improve the high quality services provided by the trust by providing additional comfort and benefit to patients and staff. And in doing that, it does some fantastic work. Next slide, please. What you have here is the brief breakdown of 21-22, where the trust had donated through a range of areas, through legacies, fundraising, investment and individual donations. The sum total of £764,000, and broken down there are some of the brief headings, and I'll go into a bit more detail on how the expenditure of £625,000 was made throughout the year. Next slide, please. This slide's a bit heavy and it's a bit small, so I shan't go into all the detail, but it sets out the trust strategy in trying to help and support each of the services going forward, how it supports our patients and future care, and how it's going to maximise the contribution. And just to say, the charity is an umbrella charity which looks after the charitable funds of all the wards and departments of the trust and raises donations from companies, individuals, events, wills and legacies, and extremely grateful for the generous donations we receive on behalf of those donors. Some examples of how the money has been spent are iPads for patients to contact their relatives, glide away folding beds for patient relatives for use on children's wards, LED skylights for Ward C4, the Georgina unit, creation of a dedicated baby bereavement suite, and staff rest areas for indoors and outdoors across the trust. Next slide, please. Here we have some wonderful photographs of some of the great opportunities that people do to raise funds for the trust. And I don't intend to do all of them, but just some examples of the fantastic things that our staff, our patients and well-wishers do. The Superhero Fun Run, which is members of the public rallying together with trust staff at Himley Hall on Saturday the 2nd of October for a 5-kilometre fun run to raise funds for the Dudley Group charity. Over 50 runners took part in the race and managed to raise 3,200, and we're still counting. The virtual London Marathon, where 5 of the trust staff members and a local councillor ran a 26.2-mile virtual London Marathon in October for our trust charity and raised over £12,000, quite incredible. And the Glitterball 2021, where face-to-face fundraising was arranged for the first time with local businesses, took place on the 5th of November, and the event raised an incredible £10,000. And the last one in this section, we have to talk about the Staff Wellbeing Hub, where for COVID-19 pandemic and recovery, extraordinarily difficult time for our staff, and the charity was successful in its application for delivering 121,000 from NHS Trust charities together. Next slide, please. So I think at this point, I have to put my salesman's hat on and very quickly say, there are lots of opportunities coming up to fundraise for the Trust, which include the charity fundraising event, the Glitter Ball, being held on Thursday, the 24th of November at the Copthorne Hotel, Maryhill, Dudley. And that is being sponsored by some of our key relationships with Mighty, Summit Healthcare, How to Find a Care Home and Dudley Building Society. A great opportunity for people to fundraise for the Trust. And over Christmas, just to mention 2 or 3 areas, the Staff Christmas Market, which will be taking place on Thursday, 1st of December between 3 till 6, based outside the front of the hospital. The Tree of Lights, which will be a dedicated virtual Christmas tree, again on the 1st of December alongside our Christmas market. And Christmas Jumper Day, which will be on Thursday, the 8th of December, when we can make a difference for younger patients by contributing a donation for as little as £2. I think that's everything on the trustees. The next slide. So I think I'm introducing now Mark Stocks, who's Head of Public Sector Assurance and Partner for Grant Thornton, who will take you through the external audit for the group. Over to you, Mark.
Good evening, Kevin. Good evening, everybody. Thank you for inviting me to tonight's meeting. My name's Mark Stocks. As Kevin said, I'm a partner with Grant Thornton, and I'm responsible for your audit. If we could just turn over to the next page. So auditors have a different duty to most commercial auditors or local auditors do. So we have 2 responsibilities. One, to form a view on your financial statements and whether they give a true and fair view. But secondly, we're required to look at what's loosely called your value for money conclusion, which is really just around how the organisation is run and operated. So over the next few minutes, I'll just talk you through both of those. The next page, please. So when we do the financial statement audit, we cover a number of areas. We look at the financial position at the end of the year, so what your balance sheet looks like. And we also take a view in terms of your income and expenditure for the year. We review in detail your annual report and also your annual governance statement to make sure that that reflects our understanding of Dudley Group. And then we also look at your as to whether the trust is a going concern. Going concern's a rather loose concept in the NHS. In reality, unless the government dissolve the organisation, then you would always be a going concern. So we look in a little bit of detail in terms of your financial position and how we think you're going to fare in the future. Next page, please. All auditors operate something called materiality. It's absolutely impossible to audit every transaction within your financial statements. So we sort of set our materiality, which then drives the numbers of samples that we take of your expenditure and of your balance sheet. And for this year, we set that materiality of around 7.5 million. Next page, please. In terms of how we approach the audit, we look for the significant risks within your financial statement. These tend to be around sort of the key estimates you have in your financial statement. So things like, the valuation of the property and plant and equipment that you hold. We also look in detail at the ability of management to override control. That can be a number of things. It can be the ability to change estimates or figures in the financial statements, and we do quite a lot of work around that area to prevent fraud. We also look in detail at both your revenue and expenditure, just to make sure that they're brought to account appropriately. I'm pleased to say that there's no material issues identified on any of those areas or any of those significant risks, and there's no evidence of any management override of control in terms of how your accounts are prepared. Thank you. Next page. So in terms of where we got to with the financial statements, we gave a modified audit opinion on your financial statements. So that basically said that we were happy with how the statements had been prepared and the figures within them. Okay, so that's the financial statements audit. The next part of the work that we do is around value for money. And when we the value for money work is set by the National Audit Office in terms of the work they want us to do. And so we look at three areas. We look at the financial sustainability of the trust, we look at how it's governed, and then we look at the economy, efficiency and effectiveness of the trust, which is quite a wide-ranging review, looking at sort of your overall strategy and the plans that you implement, how your performance managed, all the way through to procurement. So that's quite a big area for us to look at. So these are the conclusions that we reached. I'll talk through them in more detail. But in terms of financial sustainability, I do have some concerns. I think it's quite a tough environment for the NHS at the moment, and I will come back to that in detail. In terms of governance, there was no significant weaknesses, so I was happy that that was a sort of a green rating. And then on improving economy, efficiency and effectiveness, it is quite hard to get a clear rating on this one. So, you know, it's quite a tough test to run an organisation perfectly. So there are a couple of recommendations that we have. So looking at financial sustainability, Dudley Group has always had a really strong record. So in terms of its financial management, it delivered a surplus in 21-22. In the previous financial year, it managed to break even though it was going through COVID time. So it was, you know, some really strong results there. The way the NHS is funded has changed this year with the withdrawal of COVID funding. What we're seeing is quite a lot of stress within the financial system for the NHS, and quite a lot of trusts and other organisations are struggling. Dudley Group is no different. You have a significant savings plan to deliver this year to break even. I know you're working hard with your partners within the health economy, but I think there are some more financial pressures emerging, and I think there's going to be a stern test for the organisation. And there is, I suppose, a reality that you may be in deficit at the end of the financial year, because there are some savings gaps that we're seeing of somewhere between 10 to 16 million. So management are aware of this. I think it's been very open at the board. Everybody's working hard to get you to the right position for the current financial year, but I think it is going to be tough to get you there. Just next page. In terms of governance, no issues I need to flag in terms of governance. You know, the slide starts off with that I think the governance of the trust is appropriate. I think that's a fair statement. You know, we do look in detail at your board assurance framework, at doing internal controls and so on. But, you know, I thought that was a good outcome for the trust in terms of, you know, its overall governance being strong. Next page. So economy, efficiency and effectiveness, we do look at quite a lot of areas. So, you know, as I said at the beginning, you know, I'm happy that you have appropriate strategies and plans in place. You have good arrangements for actually monitoring the performance of the organisation. And I was listening carefully at the beginning in terms of all the good things that are happening at Dudley Group, and they reflect my understanding and knowledge. There is, again, a reality that, you know, that there's quite a significant backlog within the NHS in terms of what it's trying to deliver, and that's reflected, you know, in how the trust is meeting its performance standards. And, you know, I think it's going to take a little while for you to catch up with those backlogs and get back to perhaps where we were 2 or 3 years ago. We take quite a lot of notice. Sorry, just go back, please. Sorry. So we take quite a lot of notice of what the CQC says. You know, we do follow up on what they've reported to you. So we followed up the 2019 review. We also looked at sort of what they'd said around emergency care on Ockenden. And again, we could see that you were doing a lot of work around that. The other area we look at is your partnership working, and obviously, you know, there's lots of good work that we can see across the Black Country in terms of how you're working with your partners. I think it's a little early for me to say that that's sort of, you know, having a significant impact on patient lives, but we will revisit that next year. The area I just wanted to leave you with was really just about sort of how all the partners in the Black Country take forward sort of the role of Dudley Integrated Health and Care. So at the moment, there's a lack of clarity on the trust role, and I think it's important that all partners play a role in finalising that and making sure that there's a clear strategy for all health services within the Black Country. So finally, just onto the next page. So, you know, we did make a number of improvement recommendations around economy, efficiency and effectiveness. They're pretty much the norm in terms of what we're saying to people. So there's a bit of improvement around financial modelling, so around registers of interest. You know, all of this is set out in the report. But overall, you know, very comfortable with where the trust is in terms of managing economy, efficiency and effectiveness. I'm going to pause there and I'll hand back to Sir David. Thank you.
Thank you, Mark, and good evening, everybody. My name is Alice Charles. I'm the publicly elected governor for Stourbridge, and I hold the position of lead governor. And I'd like to thank you all for joining us this evening. Firstly, it gives me great pleasure to formally welcome Sir David Nicholson as the new Trust Chair and also Chair of our Council of Governors. What a privilege it is for us to have Sir David joining Dudley, and we know that Sir David will join us and continue to build on the great work that has been done in the Trust previously, and we know that his knowledge and experience will be invaluable to us in Dudley. Yet again, we have faced another challenging year, as we are all now learning to live with COVID, but are mindful that it has not gone away. And to add to the mix, we are already feeling our winter pressures. We have also experienced major changes at national level, with the abolition of CCGs and the formation of integrated care boards and integrated care systems, which came into force in July, which as governors, we are working out what that means for us in terms of the wider system working. And no doubt, with the country's current financial position, there will be yet more challenges along the way. But despite these challenging times, I would like to place on record a huge thank you, without exception, to all the staff who continue to work tirelessly for our population health 24 hours a day, 365 days a year. I would also like to pass on my personal thanks to my fellow governors, both past and present, who continue to raise the patient voice. And I would also like to thank you, the Trust Office, as without their unwavering support, the Council would not be able to function as well as it does. Okay, I'm now going to take you through just some of the events and activities that governors have been up to this year. So, our council is made up of 25 governors right from right across the borough, and it is made up of staff appointed and elected governors. Our term of office usually lasts for about 3 years, and the Trust has a rolling schedule to fill vacancies when our term of office comes to the end. So a snapshot of our activities are, so meet your governors stand. So we had that earlier on in the year. We've also had place audits. This is where governors go onto the wards to accompany the staff teams to see what's happening in the wards. And also one of the great nights of the last few months was the Committee to Excellence Awards, where we were able to celebrate the fantastic work that the staff team had put in and recognise various people's achievements. And also the few governance matters that we did is we've appointed a new Trust Chair as a recognised, and we have ongoing governor elections with more coming up in 2023. So please, if you're interested to get involved or maybe become a governor, look out for the upcoming elections in 2023 by visiting our website or contacting the Trust office. Thank you, and I think I'm now handing back to Sir David. Thank you.
Thanks, Alex. And just to kind of reinforce the points that Alex made, can I again thank the governors for their selfless work to support and challenge us, but also encourage anybody who's thinking about being a governor to put themselves forward to Alex and the team. It's a really important part of the governance of the organisation. It's the bit that connects the trust to the local community and to the staff groups within it. So really important that people feel they like to do it, to put themselves forward to make that happen. Thank you. Now, according to my agenda here, we've got a 10-minute comfort break, but with your permission, I'd like to carry on. I think I don't want to lose any of the time that we've got, particularly for questions and answers. So what I propose to do is just to move straight on to Mary Sexton, who's our brilliant Chief Nursing Officer, who's going to talk about the quality report. Mary.
Thank you, Sir David. And it gives me great pleasure to present the quality account updates against our priorities for 2021-22. And whilst that might seem like a long time ago, it is important that we do recognise the progress that was made and the achievements that were hard won by some of our teams and staff. So in 2021-22, we set ourselves a quality priority to improve the way we communicate and engage with patients, focusing on how staff communicate and treat patients, but also that they would make sure that they always introduce themselves. And I'm really pleased to say that we actually achieved that target, achieving 98.1% of our staff always introduce themselves to their patients. In respect of the next target, we had a partial achievement, partly related to patients reporting that they did not always feel that they were effectively informed of the care, treatment or tests that they may be undergoing. And whilst we've made good progress with over 90% compliance, there is still some further room for improvement. We regularly and routinely held some quarterly focus groups with each of our key planned actions around some of our speciality areas. Unfortunately, due to the COVID pandemic, we weren't able to carry out as many focus groups as we would have liked in person. But I am pleased to be able to say that we have reinstated that over the last 6 months and have carried out a number of listening interactions and focus events. In respect of the next priority, which was around engaging with our colleagues, our patients within attending emergency department, we did actually identify and worked with the senior nursing teams downstairs in our emergency department to improve communication and to make sure that they did actively learn from the feedback we received and made the necessary changes and improvement. And lastly, we developed and engaged with our expert volunteers and agreed a joint policy for patient experience and governance, where we're actually able to ensure that service users are actively involved and help support improvement of services. And this year, as we move forward, we will further develop that through our patient partners approach. The next quality priority related to ensuring all our complaints are responded to in accordance with the Trust Complaints and Concerns policy. And whilst we have seen some improvement, I think all of us will recognise that we still have some further work to do. We have managed to improve the overall response rate to 35.9% in 21-22, and I know that we have further built on that since the pandemic restrictions have been removed, and we have now been able to carry out more of our face-to-face meetings that we like to do with our complainants. The other action we had was that we wanted to make sure that we were learning from all the patient feedback. And to ensure that actually that learning was actually put into improvement steps that we took within services. So with our services, we continue to share complaints both anonymously and in person. We've had a number of complainants come in person to our development and learning sessions to share their experience, so that staff can reflect, learn and make improvements in practice where appropriate. In respect of moving forward into 22-23, recognising that we weren't able in all cases to fully deliver the quality priority we set ourselves due to the COVID pandemic and the challenges on all of our teams and all of our services, we have chosen to keep only 3 quality priorities moving forward. One is to continue to work and develop how we deliver a great patient experience. We're going to further use patient feedback to drive those improvements. We want to see greater information sharing with our patients and better discharge planning. We're also going to look at the complaints backlog, which I know we have reduced, and we also want to make sure that we continue to respond to our complaints in a more timely way. The second area will be about treating our patients at the right place at the right time. And that very much is around how we ensure we have sufficient capacity and flow through the same day emergency care, development of our ISTEC pathways to increase the number of discharges before midday and to offer better utilisation of the discharge lounge. And we want to really involve our patients every step of the way in how we develop those pathways and services moving forward. And then the third area is about how we reduce avoidable harm. We have a clear understanding of the backlog of harm due to pressure ulcers, and we've been working very closely to reduce further grade 4 and grade 3 pressure ulcers within 30 days. We have learned quite a lot from the reviews of those cases and working very closely both with our community teams and our in-hospital clinical teams to further reduce risk of avoidable harm due to pressure damage due to patients' mobility and or other factors that might mean that they're more susceptible. So that's a whistle-stop tour of our quality cap for 2020-21. Yes, 21-22. And it is now my great pleasure to introduce you to matron Lucy Roska, who is going to talk to us about the paediatric virtual ward. Lucy has been instrumental in the development and implementation of this work stream, working very closely with her multidisciplinary colleagues to reduce hospital admissions for children, but more importantly, to support the families to keep their children well. So I shall hand over to Lucy. Thank you.
Thanks.
So now Abdullah's on virtual ward, I can record his observations as much times as I want throughout the day, record them onto the pad that's given with the virtual ward, and a member of staff will call me twice a day just to ask how Abdullah's doing, and that reassures me that he's safe in our own home environment. The new virtual ward would be great for me and my family, as it will stop Abdullah staying in hospital longer than he needs. If he is only requiring a tiny bit of oxygen, he can come home with the guidance of the virtual ward and keep him safe as well. If there is any other families out there who are having lots of admissions in hospital, I would definitely recommend you speak to a member of staff and talk about this new virtual ward, as it has helped us a lot.
So the virtual ward would definitely benefit other families, for the simple reason is I run businesses myself, I've got family commitments, my kids go to school, so if your child was ill at home and you was under the ward nurses, it's a brilliant piece of kit because you can bring it home, they can monitor your child at home, they can see every result from home, which is beneficial to us, including the hospital. It saves resources with beds, it saves us the times to sort out arrangements at home, sort out arrangements for businesses, work commitments, etc., travelling to and back and forward, wasting services that are not really needed that other people can benefit from in a more serious condition. The virtual ward is massively beneficial because you can do all of this at home in the comfort of your own home, still plan your family life, still take your kids to school, still go to work if needed, even down to the point where your family, it's so easy to use, even they can use it, even your friends can use it. It's so straightforward and the best piece of technology I've seen the NHS have put out there.
So as you can see, the virtual ward in practice, a way in which we can support children in the community without having to go into hospital, but be able to provide guidance and support to their carers, to enable them to live as normal a life as possible. As you can see, it's been recognised by the Nursing Times. It was a finalist, a fantastic evening for our staff. Lucy, I think, has been delayed. Oh no, Lucy hasn't been delayed. Sorry, Lucy's been delayed slightly, but she's now appeared as if by magic. So welcome, Lucy.
Thank you.
I know you've been juggling everything in order to get to where you are, and we do appreciate the efforts that you've made to talk to us tonight. But I'm just saying, we've seen the film, and I've said what a wonderful thing it is. I think you want to say a few words to put it into some kind of context and to tell us about the detail of how it happened. Lucy.
Thank you ever so much. I'm really sorry that I have been delayed. So you've seen the feedback that we've had from some of our families, and this is an initiative that's something that we're really proud of in the Dudley group, and especially within children's services. So we established the virtual ward on the 1st of March this year. It wasn't particularly always easy, but we absolutely saw what the benefits could be for the children of Dudley and for the capacity and the flow of the trust. Since starting, well, it was developed basically to support young children at home with respiratory illnesses and to enable us to get children home quicker to recover from illness in their own home, giving them the expert support and guidance they needed to be able to monitor those children at home. Children get a kit that they take home with them, and the parents are taught before they leave how to use that kit, and they get a virtual pad that they're enabled to talk to us, and they're enabled to give us those results instantly. We were the first in the country to develop virtual ward, which is something that we're really, really proud of. So paediatrics at Dudley Group really put virtual ward on the map. We have been so proud to use this, and we've shared all of our knowledge and our success really widely. So we have improved patient experience as well as releasing hospital beds, clinical hours, and we've reduced visits to A&E and the PAU assessment area within the trust. We've continued to improve the methodology, and we're still really digging deep to look at what the benefits are. We're even looking at how we're reducing our carbon footprint by the use of virtual ward and what that means for the trust from the Greener England project. So far, we've seen approximately 200 patients via virtual ward, and that continues to grow week by week. We're filling the virtual ward beds. We're really thinking about how we can utilise virtual ward across all of the services in paediatrics, not just with children with respiratory illnesses. So we're developing clinical pathways, looking at how we can use this really great system to be able to look after all of the children of Dudley, and giving them the support they need at home. We have been really, really fortunate this year that we've been recognised by the Nursing Times and the RCN Awards, and we were finalists in their categories. Unfortunately, we didn't succeed, but there is always next year, and we won't stop until that we are successful for those. And we were very proud to be finalists, and we did win the Commitment of Excellence Award. So if we could just move on to the next slide, please. So like I say, we are really proud about this, and it's something that because we've been first in the country, we've been approached by many different areas looking at how they can develop paediatric virtual wards within their area. So we go wide and far talking about it. I will talk about virtual ward to whoever will listen to me, which some people on the call will know. It's something that we're extremely proud of, and it has worked very well, and other integrated care systems are moving forward with very similar plans. So Sandwell developing a paediatric virtual ward alongside New Cross and BCH. So we have supported BCH in their plans for their development of their virtual ward as well. So we've touched on what the benefits are for the trust. We know we can release bed days, we can increase bed capacity, we can help the flow through PAU and ED, and those are really, really, really valuable things. But actually, to us, what matters was the view of the patients and the parents. And I think you from the video you've been able to see how it's really impacted on the children of Dudley and their patients and their parents. And these are just some quotes from some of our parents that have used it. We haven't really seen any negative feedback. We are very open to feedback, and we do really seek that feedback to try and make any changes to virtual ward that's possible. But so far it's been very positive. We have been successful that we're doing a rapid evaluation of the system, and that will look at the qualitative and quantitative data in relation to virtual ward, and really be able to embed this service and change this service for the needs of Dudley and what we want to be achieving. So we've heard from Abdullah's mum and Tyler's mum about how successful it's been, and I really do just want to strengthen the fact that we are using this system more and more. It is really making an impact of these children, and it's something that we're able to fully develop, and we are looking at how we could use virtual wards in other areas. So how we could maybe use it with the neonatal babies and how we could get neonatal babies home, and that's something that's really exciting that hasn't been done yet. And I think given that we've used this innovative service in paediatrics, it's only going to strengthen how we can use it in other areas and departments. So thank you ever so much for for accepting me and asking me to come and present this. And if you have got any questions, I'm more than willing to answer them.
Thanks, Lucy. That was fantastic. There will be an opportunity after we've done the more formal stuff for people to ask questions of anything. So if you hang around, that would be great. But really, almost an example of what we've been talking about tonight. Being able to provide best-in-class services for the people of Dudley, for doing it first so that the people of Dudley get the opportunity to do it, and then spreading our influence across the Black Country. I think they're all great things, and you're a fantastic ambassador for the organisation, Lucy, and thanks for the work that you've done.
Thank you.
So that nearly brings us to the end of the formal part of the meeting. Before we go on to the Q&A session, I need those present endorse the receipt of the formal statutory reports presented here this evening, these being the annual report and accounts and the auditor's report. Can I confirm your support? I don't know how I do that. Anyway, I've got some. Okay, well, thank you very much. Thank you very much. So let's then. So we get that resolution. Thank you very much. Now then, the next item that we've got is the Q&A session. We asked if people wanted to submit questions beforehand, and we've had a couple submitted. So if it's okay with you, I'll take those first, and then we can open it up more widely. And they're from a gentleman called Rex Palmley, who's a former governor, as it happens. And there are two questions he submitted, and I'll read them out so that how is the hospital ensuring that all visitors wear a mask? There are signs around the hospital asking people to wear masks, but not everyone is wearing a mask. How do you stop or make people wear a mask? Mary, can you help us with that?
I can do my best to help you with that. Thank you. It's a very critical question, really, and in some respects, this does come down to personal responsibility of the public. So what we are doing is ensuring that in the areas that masks must be worn, that actually members of the public are encouraged to do so and provided with the relevant mask and or any other additional hand washing facilities. Within the public areas of the trust, so for instance, entering the main entrance, the kind of public corridors, there is not a requirement to wear a mask in line with the national guidance. On entering the clinical areas, which also include outpatients, we have undertaken a risk assessment and we are requiring members of the public to wear masks. And what we will do is we will make sure that they're provided with the mask and we will encourage their adherence. But it is a challenge, and I think it's fair to say that the majority of the public are very supportive and will comply. But we do from time to time come across some individuals that are maybe less accommodating, and we will work with the clinical teams and those individuals to try to encourage them to wear the masks. I'm sure colleagues on the call will appreciate I can't necessarily enforce a member of the public to wear a mask under the current national guidance. All we can do is offer the appropriate public health advice and encourage them to do so.
Thank you, Mary. But just to reiterate the importance in the clinical areas of everyone wearing masks, including the members of the public. And certainly, if I see any, I do remind them of that. The next question is, this is a slightly more technical question, I think. How has the SDEC, which is the well, we'll explain what it is in a minute, unit, benefited the hospital? Mr. Palmley was currently referred directly to SDEC by his GP. He was inquiring if the SDEC has helped in relieving the pressure on the A&E. So, Diane, can you just tell us what the SDEC is and how it fits in and how effective it is at relieving pressure from A&E?
Yes, I can tell you what SDEC is, but Karen is going to answer the question. So SDEC is same day emergency care. So Karen, do you just want to explain about the benefits of it?
Certainly, thank you. So same day emergency care is exactly what it says on the tin. You are referred into the hospital either by your GP, or you may come in via ED and then streamed into SDEC. And this means that you fit a criteria to be seen, treated and discharged in the same day. That means you don't need to come into a hospital bed and stay overnight for treatment. Now, in some cases that may happen if people deteriorate whilst they're in hospital, but most of the time SDEC is exactly same day emergency care. Now, what happens is you are streamed to an area where you are seen by a specialist consultant in medicine or a other specialty such as cardiology, and then you are treated and discharged home. This means we can pull patients out of our emergency portals or prevent them going to ED, and that relieves the pressure on ED. You will get seen in the correct place for your correct treatment. That means we have more space to offload our ambulances and treble 9 calls coming into the hospital. I will say we're very successful at SDEC here at the Dudley Group, in the sense that we get as many patients in our SDEC areas as we do in our main ED, and that's down to the treatment and skills of our clinical and nursing teams who manage those areas. So we're really proud of SDEC, and we will go further in terms of other areas such as a respiratory SDEC, cardiology SDEC that we've got, and a frailty SDEC that we are all working on with our patients in the Dudley Group.
Thanks, Karen. Okay, let's open it more widely then for questions. I think if you put your hand up, I can catch you. I've got one so far. Helen Ashby, who I think is a former lead governor of the organisation. Welcome, Helen. And for those of you who've seen her and her family on Twitter, you'll know all about her. Helen.
Yeah, I was just, as you see my family, then you'll know where my platform lies. With the virtual clinic, which is amazing, the virtual ward, there is, for me, opportunity for it to move into adults with learning disability, to look at the health inequalities there for people who struggle to access hospital. Is that something that we're looking at? Good.
I mean, I'll ask Lucy if Lucy, are you still on the call from your perspective, and then I'll ask Mary from her perspective about the broader point. But Lucy.
Yeah, so certainly with children with learning disabilities, it works very well because they feel more comfortable at home, and actually we know that we see better outcomes because they're at home and they feel more relaxed and they haven't got that anxiety of being in the hospital. So I think absolutely from a paediatric point of view, if they come in with a medical illness, it wouldn't be something why we wouldn't put a child onto the paediatric virtual ward. Actually, it'd probably be something we would strive to do because we know we'll probably get a better outcome as long as they meet the criteria to go on to the virtual ward from a medical point of view.
But I'm definitely meaning moving it on to adults.
No, I understand. And Mary, any thoughts?
So yes, Helen, I think there is some directly transferable learning that we can apply in the adult pathways. I think there's a slight difference around the adults in respect of the virtual wards so far in the adult pathways have been worked up based on respiratory specific speciality pathways, of which obviously learning disability patients will fall into different different pathways, but that's not to say that there isn't something that we can look at how we capture that group together. As you are aware, we've got a very good lead LD nurse in Jackie Passmore, and indeed it's some conversations that I've been having with her around actually that wider support for people with learning disability to avoid hospital admission when it's not really required, but make sure they're effectively supported in their community setting. So I think there's further work to be done there, but very would want you to be assured that it is something that we are going to take forward as we look at our support for people with learning disabilities, but also people with autism as well, because that's another area that I think we could strengthen our practice in.
Absolutely, lovely, thank you.
I think it's a really good point that you've raised there, Helen. We want to think about how we might best respond to it, because I do think there's quite a lot of opportunities in the area that you just talked about, and no doubt Mary can follow them up. Right, I'm really sorry here. I've got Ken, and I'm not quite sure how to pronounce your name, Ken. But
go on, Sir David, have a go.
I think I'll leave it to you. There's nothing worse than some old bloke, mispronouncing your name. Give us a clue.
Well, I don't know where the old bloke is.
Me, I'm talking about me. Yeah.
My name's McClymont, so you want to know next time.
Right.
I've got a number of sort of question/stroke points. I noticed that you are the same Sir David Nicholson who was the big boss man at NHS England at some point a long time ago, and you're also the chair of the Sandwell West Birmingham Trust as well. We've also got some workers at Dudley who are lent, as I said, from Wolverhampton. So does this mean there is a plan at some point to merge all four of the Black Country Trusts together into one? And if it does, what would happen to the status of the Dudley Foundation Trust, particularly of the members? And then I've got another couple of comments to make after someone can answer that question for me.
Yeah, well, I'll have a go at that, Ken. So I think the Black Country, we really don't need a merger. The disruption when you try and put a merger together in the environment we've got at the moment is very significant. We'd spend 3 or 4 years working through how better to organise and govern organisations across the Black Country. The better way is for individual organisations to work together. Now, by that, you get the benefit of having a local board with local focus and local connections to the community, who can play a really important role in things like the development of place. But in a group model, which is I think where we're moving towards, you can also have the opportunity of learning from good practice, for spreading good practice, and for working much closer together in terms of staff and patients and equipment and investments and all the rest of it. So, for example, Diane gave the example of robotic surgery, where we're not doing it everywhere in the same way. We're having a robot at Sandwell and we're having a robot at Dudley, and there are robots currently in Wolverhampton, and by working together we can maximise that investment. So I'm certainly not, there is no plan to merge the organisations together. I haven't come here to do that. That's not what I'm here to do. What I'm here to do is to make sure that the organisations in the Black Country get the best of their relationship with the local community through their boards locally. And then secondly, being able to work together where it's sensible to get the best benefits for patients. Ken.
Thanks to David. I'm very pleased to hear that, because that was a worry, and I totally agree that when organisations join, merge, demerge, or whatever, it causes a huge amount of administrative disruption, and the last thing our NHS needs is more of that. Although today I think a certain member of Parliament has indicated that somehow he wants you to find more savings from somewhere. I don't know where from, I haven't got a clue, but we'll gloss over that. A couple of things I'd like to mention. Can I say not only thank you to all of the paid hospital staff in Dudley, but also all the fabulous volunteers, without whom I think the hospital would struggle. And also to all those forgotten staff who we never talk to and never see, but without whom the hospital again wouldn't function. People who work in places like the kitchen, the laundry, some of the cleaning staff, the security staff, they're all vital parts of the hospital. My last question, I don't know where this will go. As a visually impaired person, there is something called the Accessible NHS Data Standard. The idea behind this was that people that had a different communication need from standard print could inform their GP, and that the system would then pick up on whether you wanted large print, braille, audio, email, phone calls, texts, etc., to communicate with you. And certainly on any of the letters myself and my wife have had, although our preference is noted, it never happens. And it's not just at Dudley, it's at all the hospitals, and I understand it's still all across the country. Is there anyone in Dudley Trust who would like to dare to try and answer that question? Or should I send it back to Olivia Butterworth at NHS England, who's the national lead, and ask her why it's not working, as it's her project?
Diane. You're the chief executive.
Ken, you always ask us this question. Adam, do you want to have a go at answering it? Because it is your area.
I will have a go, Diane, and thank you, Ken. The straight answer is I don't know why it's not working for you in your case, and I'll pick that up. However, we do meet the AIS, the Accessible Information Standard, and we do capture that data. I can only speak for Dudley Group, but I'm certain that we do meet that standard, as we have to submit that we do. But if it's not working, we need to try and take that feedback forward and make sure that the solutions that we have in place are meeting those needs. So I think that's probably something I best pick up with your details outside of the meeting. And I can only apologise if it hasn't worked properly for you and you've had the information in the format that you've requested.
I've never had it in the format I've requested from anywhere. This is why I don't think it's working across the country. And I know the BBC only last week reported that it wasn't in other places as well. So it's definitely a national issue, not a Dudley issue. So Helen Board has all my contact details, Adam. So if you ask Helen tomorrow, she'll be happy, I'm sure, to share my contact details with you. And I'm happy to have a chat about that. And thank you all very much for keeping us up to date with what's going on in the Dudley Trust. It's, you know, an amazing job that you all do in very, very trying circumstances. And I know I appreciate you all. I can't speak for anyone else.
Thanks very much, Ken. Really appreciated. Any other questions? Ken, are you back again for another question, or is it the same hand? You're on mute, by the way, Ken.
Is that any better?
Yeah, we can hear you now.
Okay. I told it to lower my hand, so I don't know why it's raised it.
All right. Okay.
I haven't got a clue on that. It's technology is a bit weird, but there you go.
We're all in
and the
that
last
place.
question: Can we please do all we can to get a real meeting and real people in a real room next year?
Yeah.
Because I find this technology very, very challenging to use, and it is far better in person. And I do like to see real people.
Here. Yeah, I agree with you completely. Yes, we'll do what we can next year. Right then, well, if there are no more questions, can I thank you all for the contribution that you've made tonight? Thank you for listening to what we've been talking about. We've really enjoyed providing you with information about what we are trying to do. We're not perfect by any stretch of the imagination, and we work hard to do the best for the people of Dudley, and we really appreciate the contribution that you make and the way that you engage with us. So thank you very much, and I'll see you all next year, or perhaps before. Thank you.
Thank you.
Thank you.